Face masks can significantly reduce the airborne COVID-19 transmission. The study conducted by a team of scientists in Hong Kong found the rate of non-contact transmission through respiratory droplets or airborne particles dropped by as much as 75% when masks were used. So is this the new way of the world? Here to discuss, Dr. John Campbell, an academic and nurse lecturer for 40 years and founder of Campbell Teaching. Dr. John, it's good to see you today. Now, the images coming out of different parts of the world, we are seeing so many different people wear face masks. We're being told by governors here in New York to wear face masks. A lot of stores, you see signs saying you must wear a face mask to even enter the store here. In your opinion, how long do you think this will go on for? Is this just the new normal we should get used to?
I think this is the new normal that we should get used to until there's a vaccine. Now, some of the studies you referred to there are really fascinating and ingenious. So that study you referred to was actually from the University of Hong Kong. And what the microbiologists did there in Hong Kong was they took infected hamsters, because hamsters can get this as well. And they had a cage of infected hamsters, and next to that they had a cage of uninfected hamsters, and they had a fan blowing between the two. And when they put a mask over, not the individual hamsters, but when they put a mask over the hamster cage with the infected hamsters, then only 15% of the hamsters in the other cage were infected after a week. So having the infected hamsters masked off, just like having a human being masked off, meant that only 15% of the hamsters got the infection. And then when they put the mask over the hamsters that weren't infected, in other words, the hamsters in the infected cage had no mask, and the hamsters in the hamsters in the infected cage had no mask, and the hamsters in the non-infected cage had a mask, that only protected them by that gave them 33% of cases. So what this means is, if someone's infected, if I'm infected, when I breathe out, I'm breathing out lots of water droplets. And because this is a respiratory virus, the virus is in the bronchial passages, and I'm going to breathe it out in big droplets and small droplets. And that means the virus can go from me to you. Now, if I'm infected and I wear a mask, that's going to stop me infecting you. And according to this figure, it'll mean that your chances of getting infected go down to about 15%. But if you're wearing a mask and I'm infected, but I'm not wearing a mask, then you've still got a 33% chance of infection. But the interesting thing was, when they had infected hamsters in one cage and non-infected hamsters in the other cage, and none of them wore masks, then 66% of the non-infected hamsters became infected. So this actually is quite profound. Now, the reason I like this study is, in March, in the Journal of the American Medical Association, Linda Balboa published a study where she looked at the way the air comes out the mouth and the dynamics of this. And she found that if someone sneezes, they can transmit droplets for up to 26 feet. If someone coughs, it can be 19 feet. And just with ordinary speech, it can be 7 feet. So what a mask does, if I'm infected, is it takes away the physical momentum of the air. It breaks up that momentum and stops it from spreading. And this has got huge implications. So if everyone wore a mask, if 80% of people wore masks, then transmission could be reduced by over 50%. In other words, wearing masks can be as effective as lockdown. So what would we like to do? Would we like to have $1 trillion lockdown, or would we like to mandate that everyone wears masks in public places? And it's also got great implications for air conducting systems in buildings. So in Thailand, when this pandemic started, what they did was they turned off the fans, they turned off the air conditioning, and they opened all the windows and diluted any virus that was in the room. So opening windows, a through flow of air, reducing the viral load, reducing the viral spread, absolutely pivotal. We can do this, and it costs essentially nothing. But everyone's got to do it. 80% of people have to wear masks.
Yeah, you know, we were talking with the doctor yesterday about the importance of just getting outside yourself even, you know, to kind of avoid staying in those closed off rooms and environments where those droplets could be circulating, and you're right, not escape. So, you know, you make a great point about those hamsters and the importance of a mask here. You know, you would want to save as many of them as possible from not getting infected. But the question here is, would it make a difference what that mask is? You know, so many people you see, they're wearing scarves or bandanas, but there are, you know, higher, more quality, more medical grade masks out there on the market. Is that going to really make a difference here?
It's a great question. Now, it depends what you're trying to do. Now, if you want to protect yourself, then you need to wear a very well-fitting mask. with very fine filtration facilities, like you would do with personal protective equipment in a hospital. And those masks will filter out particles down to 3 microns in size. So that would protect the individual from viruses in the outside environment. But the only time that would really be a problem is something like in the hospital situation where there's a very high load of the viral particles in the air. So that's going to give you good protection in a hospital situation. If you're talking about a supermarket or in public or going to work, it's not going to give you so much protection. It's better than nothing, but it will only give you a little protection. But these masks are relatively difficult to fit and they're a bit complicated. So that's if I want to protect myself. But what we need to do as a society is, if I am protected, I need to protect everyone else. I need to protect you. And to protect you from me takes a fairly simple mask, because this work that Linda Balboa did, she proved that it was just the physical momentum of the air that was spreading the virus out. So if I've got even a cheap mask, like a cheap surgical mask, or just a bandana or a homemade mask, one of these colourful homemade masks that people are wearing, and I'm wearing that over my face, as an infected person, it means I'm not going to infect you. And of course, with this virus, I may know I'm infected because I'm ill. In that case, it will still protect you from me. But more likely, I could be pre-symptomatic. Yeah. So for 3 days before I develop features, I could be infecting you. And it's estimated that up to half of the people that get this virus are actually asymptomatic. They have no symptoms. Yeah. So I might think I'm fine, go to the supermarket and not get sick, but infect you. You could get really ill, and I could recover in a day or two and never know I was sick, whereas you could end up on a ventilator or something. So it's vital that everyone does this. It's got to be universal. It goes
to your point of the importance of wearing masks here. And I want to talk to you, just so we don't run out of time here, about this, that South Korea CDC reporting that patients who test positive a second time for COVID-19 are not a danger to pass on the virus to others here. Now, we've been worried this whole time about the chance of potentially getting reinfected by the virus. Does this study kind of help clear that up?
It does. You know, this wearing mask study is a really good news thing, because it means we can make a massive difference really cheaply. And this is the second really good news story of the day. Now, we've had reports from China, Hong Kong, early reports from Taiwan, and a lot of reports from South Korea that people could get the virus, be sick, make a full recovery, and then test positive again. So the question was, are these people getting reinfected from someone else? Or some viruses will live in the body for a long period of time, like HIV or hepatitis, and the virus can be reactivated. So this was a big worry. Is this going to become endemic? But I think this study is evidence that that is not the case. Because what was happening in the Korean study, and they studied 290 people who had had the virus, got better, and then were retested, and they were given the virus antigen test, and they were testing positive. So this was really frightening. These people had got better. 2-3 weeks later, they were still testing positive, or testing positive again. But what the Korean scientists actually found in the Korea Center for Disease Control, these are the best microbiologists in the country. What they found was that what they were detecting, this PCR test for the virus, is so sensitive. They were detecting what we might call dead pieces of viral RNA, which were being coughed out by the individual some weeks after. Because the virus won't always kill a cell, and so you could get viral residues in the cell that could be detected weeks later. But this virus is dead. And when we say dead, what we mean is the virus will not make that person sick, and it will not infect someone else. And of all the contacts, there was nearly 1,000 contacts of these 290 people that they studied in South Korea. Not one of them had passed the virus on to anyone else.
Okay.
So this means that they were immune in every reasonable sense of the word.
Great. Okay, we've got to leave it at that. Always good hearing from you. Thank you for explaining all these studies. It's Dr. John Campbell, nurse lecturer and founder of Campbell Teaching. Doctor, thanks for joining us. We'll see you at the same time tomorrow. We appreciate it.
Thank you.